We are over 100 people. We definitely want this session to be extremely useful for everyone and to give you the option to participate. You will be muted, but you will be able to unmute yourselves. And so only raise your hand whenever you have a question. And I should also let you know that we are, for the sake of retaining the questions that you have and the answers provided, we are recording the session. So if anyone has a problem with the, having your image on the record, just keep your camera off. Otherwise, we would prefer whenever you have a question, you can put it on, but definitely is your option. And well, let me, if I'm calm. Yeah, the session will be focused on the question and answers part, but we thought it would be useful to give you a brief presentation about ROSIA and about the actual tender. We will use around 20 minutes for that. And afterwards, we will go to the questions and answers. Nevertheless, because as I said, there's more, it's close to 140 people registered for the session. We will do our best to answer any question you may have during this session, but definitely any question that you are not able to put here or any further clarification you would like to have after this session, you can submit it through the platform, through the tender platform, and we will be, dutifully answering any question that you may pose for us there. So it's not a one-off opportunity for you to get clarification. That's what I mean. And so I would just, give you a small reminder. Again, I'm taking that you have some level of familiarity with the project, because otherwise you wouldn't be in this session. But just to let you know, we are a consortium. With different components, 3 procurers, and that's a very, a relevant point of it, from 3 different countries, from Spain, Servicios Aragones de Salud, from Ireland, National Rehabilitation Hospital, and from Portugal, Centro Hospitalario Universitario de Coimbra. On top of that, or by the side of that, we have a knowledge nucleus of partners spread of all around Europe that is providing and supporting us procurers in designing what we want from this project and assessing the kind of solutions that you would be able to provide for us. And probably the last point I would like to highlight is that we are going to be implementing the solutions that at the end of the process get selected in local sites. And those local sites are 2 in each of the countries. So we have Barbastro and Teruel in Spain, in Aragon, Penela and Soura in Portugal, and 2 locations in Dublin for Ireland, in Ireland, outside Dublin. I think that more or less, and we are spread all around Europe. So probably I will leave it there, and I would like to introduce you my colleague, Ali McLean. Ali works at the National Rehabilitation Hospital and has been so kind to take the stake for the group and make the brief presentation about the project and the tender. So thank you very much, everyone, and Ali, the floor is yours.
Thank you very much. I will just share my screen and go to a slideshow. Lovely. So just to give an overview of what the presentation will include, we'll give some background to the ROSIA project. We will go through the PCP procedure, the pre-commercial procurement procedure, then some details about the tender documents and how to build a consortium before we open it up to questions. So the ROSIA PCP, the project aims to redesign rehabilitation services for remote rural areas, providing access to people living in isolated areas. ROSIA will take advantage of new technologies to integrate social and health services with the available community resources in patients' villages and towns. ROSIA and its services will be prescribed and supervised by rehab specialists in central healthcare facilities. ROSIA started in January 2021 and involves 12 partners across 5 countries. It is funded by the EU with an amount of 5.5 million euro. The project's 3 public procurers are Servicio Aragonés de Salud in Spain, Centro Hospitalario Universitario de Coimbra in Portugal, and the National Rehabilitation Hospital in Ireland. The project conducted an open market consultation last year to gather information from market suppliers, inform the market about ROSIA's procurement plans, and to outline the needs of the project's public procurers. A successful PCP requires involving the relevant stakeholders to gain market insight on the state of the art and future developments, and to also give them an opportunity to create bidding consortia early on. Rehabilitation is a long, demanding and challenging process which requires extensive clinical resources. In remote areas, as aging increases, so do demands for rehabilitation. But resources are often scarce and unequally distributed in these areas. And here, telerehabilitation can help, and the technology is ready. But the current rehabilitation market has no comprehensive solution for the integration of the diverse tools available. What is required is a solution which paves the way for the development of new answers to these challenges, which is integrated with clinical practice and supports the implementation of tailored clinical pathways. Telerehabilitation is complex. Healthcare systems require a transformation process towards these tailored integrated care models with new roles, tools, and responsibilities, and relies on increased digital literacy of patients. And the healthcare systems must not only manage sensitive patient data, but also must integrate with a diverse set of digital services into their ICT systems. Now, as for developers, they encounter fragmented care models, a lack of prescription procedures, and a diversity of the health system's ICT systems. And this can mean that the costs of development are prohibitive. The ROSIA challenge is to develop an innovation ecosystem comprised of an open platform, a developer layer, and a catalogue of apps and smart devices to be prescribed to patients as part of their rehab plan. Core aspects of the ROSIA model are telerehabilitation, which is the provision of remote rehab and self-managed rehabilitation supported by technology and procedures. Integrated care, including the development of shared tools and services to implement care pathways and to support this new rehabilitation model, and the education and empowerment of patients and carers, developing innovative approaches, tools, and services to support patients and carers to independently manage their condition. ROSIA is underpinned by value-based healthcare, seeking a business model for long-term sustainability centered around the concept of improving value for all stakeholders through measuring patient outcomes and costs. Some of the benefits and methods that ROSIA could scale up are generating evidence of proof of concept, which will encourage other regions and health services to integrate ROSIA into their services. This may then create a domino effect in the industry, and the industry may also find a way into the market through ROSIA's catalogue plug-and-play approach. Next, we'll talk about the ROSIA PCP procedure and the PCP process. Here at the top of the slide, you can see some of the main features of the pre-commercial procurement in ROSIA, what buyers expect in each phase, the estimated number of potential bidders, for example, 5 potential bidders in phase 1, which we're currently tendering for, and the overall budget for each phase and our timeline, with phase 1 expected to commence in October 2022, phase 2 commencing in March 2023, and the pilot testing in phase 3 starting in March 2024. At the bottom of the slide, you can see that in phases 1 and 2, bidders are expected to develop the open platform, the catalogue, and the developer layer. Whereas in phase 3, buyers will be validating the prototype, providing telerehabilitation services for the listed clinical conditions. Next, we'll discuss the ROSIA tender documents. The overall ROSIA process consists of 3 phases, as I've mentioned already. And in order to enter each of these phases, a tendering process will be completed. We therefore have 3 phases and 3 tenders. In the boxes, you can see the criteria that will be used to select the successful suppliers to participate in each phase. During implementation, there are 3 possible outcomes for our participants. Unsatisfactory completion, where not all tasks have been carried out with adequate effort and diligence. Satisfactory completion, where all tasks have been carried out with adequate effort and diligence, whether the results are positive or not. And it's important to note that satisfactory completion does not automatically mean successful completion, whereas successful completion means that this is if the bidder is amongst one of the highest ranked in the tender and is then selected to continue for the next phase. Looking at the first and current tendering process, the evaluation process is as follows. The tenders will be evaluated in a non-discriminatory manner in accordance with the legal requirements set out in relevant provisions under Spanish regulations. Ajax, our lead procurer, will open the tenders which have been submitted by the deadline mentioned in the time schedule and check the compliance with the conditions on the content and format of the offer. Tenders not complying with the formal and procedural requirements will be excluded from the tender evaluation. The lead procurer may request clarification or additional evidence if needed. The tender evaluation is then completed by an evaluation committee appointed by the lead procurer. It will be composed of evaluators with complementary technical background, representing the buyers group in a proportional way. For this purpose, each of the 3 procurers will nominate 4 experts to represent them, and the lead procurer will have 5 members. The buyers group may ask for external experts, which may include members of the advisory board for additional support. Each member of the evaluation committee will sign a declaration of absence of conflict of interest and protection of confidentiality, and in addition shall specifically notify the lead procurer if there is a conflict of interest with any of the tenderers. Regarding the documents, we would like to highlight the following structure. Document 1, TD1 describes the call for tender, and this contains all of the relevant information about the tender process, the current one, and the next phases. Document TD2 describes the ROSIA challenge, which will be solved through this innovative process. And finally, the envelopes or folders, which will outline the required information from the bidders. These envelopes are administrative, technical, and financial. First, we'll discuss the administrative envelope, where bidders must include at all times the 5 forms listed here. The instructions for filling them in are described in TD3, and the 2 signed contracts. And only if they are submitted in a joint bid or using subcontractors must they include the annexes. Please note that when completing Form 3, you must add to the form itself 5 PDFs describing your research and commercialization experience, the CVs of your team, the risk management plan, and the level of insurance. This is an image of the Spanish procurement platform and the appearance of the required documents in the administrative envelope or folder. In order to get to this screen, you will have had to register on the platform, and among the documentation provided in the dossier, there are several guides on how to use the procurement platform, and we recommend that you review these. In terms of the technical folder, there are 2 documents to be completed, the technical plan and the business and commercialization plan. And in this case, there are no specific forms developed. You are free to present them as you wish. However, there are some instructions or guidelines to follow, and they are described in TD3, the tender forms document. Again, here is an image of the Spanish procurement platform for the technical envelope. For the financial envelope or folder, you must complete Form 7, which is an Excel spreadsheet. You must submit this in Excel so that it contains the formulas relating to the calculations made, but it must also be signed, therefore it must also be submitted in a PDF format. Again, the instructions for completing the form are in TD3, the tender forms, and the required details are as follows. A fixed total price for phase 1, broken down to show unit prices and the number of each unit needed to carry out phase 1, which is to be given in euro, excluding VAT, but including any other taxes and duties, and the set binding unit prices for the entire duration of the framework agreement, and an estimated total price for phases 2 and 3. The information provided in the financial section of the tender will be used to check if you are indeed proposing R&D services and for the overall tender evaluation on the basis of the price award criteria. And again, here you can see the Spanish procurement platform with the financial envelope. Now to discuss consortium building and matchmaking. The ROSIA challenge is complex, and as outlined in TD2, it is comprised of a number of elements to be integrated into a single project. As a result, we anticipate that in many cases, joint bids will be submitted by several partners who combine their experience to meet the ROSIA service requirements. And with this purpose, we have built a matchmaking tool on the ROSIA website to assist in the building of a consortium to submit a joint bid. At present, there are 61 companies, and they can be separated into 7 categories, providing their contact details in order to build a consortium, and the information can be filtered. In this last section, we will present some of the questions that have already been asked through the Spanish contracting platform. It is important to note at this point that you do not need to be registered on the platform to download or view the basic information on the project, but you must be registered to access the questions and answers section. Here you can ask questions and view all of the answers to questions already asked. The first question that has been asked is that there were 2 separate deadlines listed for the submission process. The correct date is the 30th of June at 1 p.m. Central European Time. If there is any other date, it is a typographical error. The second question is related to where the different forms can be found. There are 2 options. The forms can be located in the following steps, going to this link here, and you will see highlighted in blue all of the tender documents and forms. You can click each of them to view them or download them. Or if you go to this link, you can see the title of Resumen Licitación. You will see a table, select the line that says Pliego, and then go to the 3rd column, Ver Documentos, and then click on the PDF. Here you will be redirected to another page where you will see, similar to this link, all of the documents highlighted in blue, and you can click on each of them individually to download them. And now I will hand the floor over to you to ask your questions, and we'll answer those. Thank you very much.